for LIPOcel, I believe that before we introduce this treatment or these services to our patient, we need to understand what is our goal. And obviously, my goal actually is for body sculpting or body reshaping. I hope the same goal are shared by all the other doctors who are interested in either purchasing this or either they want to know more about these procedures. So establish this. This is body sculpting. That's our goal. This is what we want to do to our patient. This is what we hope our patient will achieve from a not so attractive body to a very attractive body. So now, how we achieve our goal? This is also, I guess, a practical way to ask yourself first before you purchase or before you even consider to get the machine suitable to achieve your goal. Basically, we are talking about body sculpting. There's two ways to achieve your goal. First, eliminating the fats, and secondly, tighten the skin. So I guess these are the two major goals, two major ways how to achieve your goal. First, you eliminate the fats and tighten the skin. And when we talk about eliminating the fats, we are talking about either you can go with surgical methods or you can go with a non-surgical method or non-invasive method. Well, of course, you know, the best way is to do liposuction, conventional liposuction to remove all the fats. But I believe that skin tightening also can give you that nice scalp body. And we identify these are the things that we want actually in to achieve our body sculpting treatment. We need to do some research. This is what I can gather. Among the latest statement by or given by American Society of Aesthetic Plastic Surgery. It was stated here. You can see that the green color. I will my spotlight over here. So the green color represents the non-invasive treatment. The red color is invasive procedures, cosmetic procedures. You can see there's a high jump of non-invasive procedures. And if you were to break it down, hold on, I need to go here. And if we were to break it down, what we can gather from the statistic in 2014 plastic surgery statistic report shows that surgical cosmetic procedures decreased by 12% from 1.9 million to 1.7 million versus year 2000. And minimal invasive cosmetic procedures increased by a whopping 154% versus year 2000. You can see from 5.5 million to 13.9 million. And data also from the Society of Aesthetic Plastic Surgery, for the past 2 years or 3 years, they start to do analysis on non-invasive fat reduction, such as liposonic basal shape, LIPOcel, probably one of them. So they noticed that in 2013, there's about 95,000 procedures done. 2014 is 135,000. 2015 is 160,000. So you can see an increase almost 70% as compared to 2 years or 3 years ago, 2013. So what is our conclusion looking at the data or the summary of that? First, we know that fat reduction is used in non-invasive treatment is gaining popularity. You can see the increase by 74% in 2 years shows that the demand is there. For me, personally, if I were to do research and look at this result, I'll be very happy happy to venture or to know more about what kind of treatment, what type of treatment that I want to introduce to my patient. So, if I were to focus on non-invasive fat reduction or body sculpting treatment, I will normally go to classification. So for everybody, this is my own classification. You probably have your own classification, but this is what I can gather from the literatures, the books that I read. I classify that into radio frequency, laser, ultrasound. We will discuss a little bit more on this, cryo, or such as cryolipolysis, mechanical way, SW is shock, and then combination like RF and infrared, like phosphatidylcholine, topical like using caffeine cream. So when you know that you have the classification, the type of non-invasive fat reduction or body sculpting treatment, you might need to know the pros and cons, the characteristic, the mode of action, and most importantly is the effectiveness of whether it works or not. These are the most common things that you need to understand. For instance, radio frequency, you need to know the physics a little bit. You need to know action. We know that radio frequency works by denaturating because it introduces temperature, heat, it denaturates the protein, collagen, and we are hoping for the remodeling of the collagen in order to have skin. So some scholars, some research paper already said that probably the disadvantage of RF fat reduction, the result is not long-lasting. But there's some literatures. This, I guess you can do your own research, or you already read about this. Laser, for instance, low-level laser therapy, like Zerona, literature say that the mode of action is by temporarily giving the pores of the membrane of the adipocyte or the fat cell will be open, and it will, by doing this, the triglyceride will be excluded out. And of course, like radiofrequency and laser treatment, LLT, you need to do several times. I will skip ultrasound. I will go to cryo. Cryo is another treatment that briefly is an extraction of energy. Extraction of energy by introducing a cryo or a cool energy, so that the heat going to be taken out from that particular layer in order, or we are hoping that we will damage or destroy the adipocyte or the fat between temperatures -2 to 7 degrees Celsius. Mechanical way like massage, shock wave like ECST like cell shock, injection. I'm pretty sure you heard of this mesotherapy, but unfortunately in the United States it has been banned. FDA already produced a disclaimer or notification saying that they are not or they don't encourage doctors to use mesotherapy because of a lot of side effects. And topical cream, of course, this is been sold over the counter most of the time. So by knowing this, almost all the methods available, the mode of action, the pros and cons, basically advantage and disadvantage, you might consider, then only you try to consider which are the best treatment that suits your practice. And for these purposes, I will focus more on ultrasound treatment. And ultrasound treatment can be divided into two. non-thermal, and another one is thermal HIFU like LIPOcel, non-thermal like ultra-shape. We've got to move on to the other slide. Okay. And ultrasound, based on usage, there's 4 categories. First, we know that ultrasound can be used for diagnostic. This is where, you know, the gynecologists will use this, the obstetric and gynecology going to use this for diagnostic purposes. Normally, they are low intensity but high frequency. Intensity between 0.1 to 20 watt per centimeter square, and frequency between 1 to 20 megahertz. It can be used also for physical therapy. Normally, they will use a low intensity between 0.5 to 3 watt per centimeter square, or low frequency 1 to 3 megahertz. And they can also use a low intensity and low frequency, I explained, to give a mechanical action in order to break the fats rather than thermal. So intensity normally between 17.5 watt per centimeter square. And last but not least, the topic of interest for today, we're going to talk about HIFU body sculpting, which uses, it can go as high as 1000 watt per centimeter square, and high frequency, which is 2 megahertz for this. And now we need to, like any other machines, this is where I would advise all of my friends, doctors, in order for us to really understand how the thing works, to predict the outcomes, to even ask the right question to the patient, to advise what the patient should know. A doctor need to understand, even though it's only a brief one or a superficial knowledge, but we need to understand the physics of ultrasound, or in this case, LIPOcel. We don't really need to go too detail, but first of all, among others, we need to know that ultrasound are characterized by the frequency, which is more than 20 kilohertz, because human being will only between 20 to 20,000 kilohertz. There's no detrimental effects on human tissue, we know this. The parameter they use is frequency or intensity, which is the energy. It is a mechanical wave that goes through medium. When the ultrasound hit any tissue, it will reflect, it will scatter, and it will be absorbed. This is when the absorption done. That's where, you know, when we do especially HIFU on the bony area, it tends to cause higher heat or discomfort because of the reflection of the energy. And acoustic cavitation, this is something that we also need to understand about ultrasound acoustic cavitation. When, because of the mechanical effect, there's a compression and the rarefaction of the wave itself, it will cause acoustic cavitation. Why? Or in other words, we call them initial cavitation phenomenon, because of that compression and rarefaction of the ultrasound wave. It tends to cause bubble. It tends to give bubbles to that particular molecule, for instance, or that tissue. That can, this bubble, as the frequency go higher or the energy goes higher, you're going to create a bigger bubbles, and at the end, it will be broken. It will be shattered. Basically, the bubble will burst, cause another energy. In some literature, they will say that this burst of bubble can bring between 20 to 30,000 kilobar of energy, which can be transmitted or converted into heat energy. Yeah, it enhances the absorption energy given. So thermal effect is very straightforward. This is because of the absorption of the ultrasound. What happened to the of the cell? It vibrates. The more vibration it gets, the more higher temperature it's gonna get, and at the end of the day, it's gonna give that heat energy to that particular cell or tissue. And also the heat, the thermal effect is due to the cavity or initial cavitation that I just explained. These are the basic physics that I think we need to understand. How, in order for us to understand how the LIPOcel works or HIFU works. Yeah. I will go further. Now, medical science behind LIPOcel. We need to know also the medical science behind LIPOcel. Of course, just now, the goal is to maximize ultrasound energy at the target area to cause biological and mechanical effect. The use is by using high intensity focused ultrasound, and this is what we've been talking mostly on LIPOcel about acute and chronic effect. What does it mean by acute and chronic effect? Acute effect, that means it tends because of the generated heat, the heat generated from the mode of action of ultrasound wave. It will give an acute effect immediately because of the heat. It tends to generate the protein. It somehow gives a tightening effect. And chronic effect, this is where the final outcomes, the elimination of fats, and at the end, as the end result, it will give a good sculpting result to the patient. It only targets adipocyte and collagen, which give tightening effects. And there's a metabolism of fats from adipocyte. Of course, our target temperature is between 55 to 58 degrees Celsius. I hope my presentation is okay, the audio is okay. I'm going to move on. Okay, metabolism. These are among the common questions asked by patients, actually. I mean, like, I guess my patient in particular, they want to know more. You know, logically, if you were to break the fats using HIFU technology, what happened to my fats? Is it going to go to my heart? You know, simple question, as simple as that. Will it go to other places? So I guess doctors, we need to know and able to explain briefly to our patient what happened to our fats. You know, Einstein always said this. I just want to recap. You know, a good to understand or to know whether somebody understands certain knowledge or body of knowledge is when that person be able to explain as simple as possible. So if we were to relate this to our practice on a daily practice, I believe that if we manage to explain how the works actually, aesthetic procedure services in particular, in a simpler way, that means you understand, that's one thing, and the patient to relate or to appreciate what you are trying to do is easier, and for you to administer certain procedures or certain treatment aesthetic to them, it's going to be piece of cake. They will trust you, they will proceed with the procedure. Same with fat metabolism. Tell them that, you know, once HIFU is introduced, there will be a fat cell disruption, of course. The fat cell will be break triglyceride, and some of the cell membrane and content will be there. But what happened to cell membrane and content? It will be or engulfed or eaten or taken by the macrophages, the cell debris, and the triglyceride, with the help lipase enzyme will be break into fatty acid and glycerol will be transported to the liver, and same goes to the free fatty acid. And study shows that using LIPOcel or any other HIFU technologies, when to reduce fats, the serum level for lipids and triglyceride is normal. There's no changes at all. They've done a lot of studies in this, but none of them shows any elevation of the lipid serum. So assure our patient, understand how it works, and rest assured that we can share patient that this treatment is safe. And now we go a little bit detailed after, I guess, first part of my presentation. I guess these are the things that, the basic things that we need to know. In order, before we do the treatment to our treatment to a patient, I believe that we need to convince ourselves that that thing works. How we want to know that that thing works, the procedure works, the services work, works, by telling ourselves that we understand, we know what is it all about, we are confident that technology such as HIFU and LIPOcel works to the patient. And for the practical part of it, this is pre-procedures. Patient assessment is important. What we need to do in patient assessment, this is also to my experience, because I guess in the sense of body sculpting, I do tumor cell liposuction. I do a non-invasive, invasive or minimal invasive liposuction. I've been doing this, I think more than 10 years or so. I also do have other what you call non-invasive body sculpting treatment like RF. I use some. I used to have LLT also. So, but I noticed that in any services or any treatment that we want to do, every treatment or services need to have a specific assessment methodology. And for LIPOcel, this is important before the patient comes in. Physical part of it, we need to know the BMI, because we know for LIPOcel, we need to make sure that the patient is not, it should be between, it doesn't go beyond 30, BMI shouldn't go beyond 30. This is number one, because anything above that, result wouldn't be that good. We need to know about the age also. Normally, in my practice, I will go with between years old to 65 years old. We need to identify also, is there any localized fat or not? Is it a visceral fat? Is it an external fats? Is there any blood disorder? We don't want to get into trouble, especially the fact that HIFU or LIPOcel can cause some accumulation at the end of the procedures. Are they on medication? Of course, lactating mothers and pregnant are not suitable for this treatment. Not forgetting patients who are having implant, implant are not contraindicated. So know your patient, and like BMI, age, like BMI also important. The weight also need precisely, because this is related to the outcome of our LIPOcel. Of course, we need to also know their mental behavior. I'm pretty sure all of us should know by now that, you know, over unrealistic expectation, these are the #1 contraindication, I guess, for me at least, to all my patients. I will reject them, because no point. Even you were to do conventional liposuction, patient will still complain and come to you. Moreover, like BDD patient, you know, disorder, definitely you need to make it as a contraindication. And bear in mind, financially also, because for me, no point for you to push or to persuade patient to come and do LIPOcel or HIFU treatment, because in my country, LIPOcel treatment is considered to be mid-class and high-end market patient, because well, one treatment, a regular treatment, shots probably going to cost them about let me see, 8,000 ringgit is about like 2,000 times 4. Yeah, it's about 2,000 USD for 100 shots. So I guess you need to know your market, your patient. Which target group are you looking at? Okay, I'm going to move on. Now, pre-procedures measurement. This is also an important part. Before I go any further, I will share with everybody. I hope I will be able to attend on the next SALSA meeting in Seoul. If I'm not mistaken, they are March, because I will share a case study, clinical study done by me. So these are based on the measurement that I put among the important things that I believe doctors need to measure before they put the patient for the I did a study at 4 weeks and 12 weeks. The details of that, as I said, we're going to discuss, or I will hopefully can share. But like the measurement of the abdominal, like the abdominal circumference is important. How to measure that? This is also the technique to measure abdominal waist circumference is always important. Don't do it too fast. Make sure that if you were to assign a staff, make sure you do it properly. How to do it properly? There's a lot of literature talking about it. For me, I will make sure that I will make 3 areas or 3 marking from the to the floor. I will measure it properly, put it on paper, and then standardize method of measurement to all my patients. During practical session, I guess in Seoul, I will share with you how I do my measurement, so that believe me, even 1 or half a centimeter difference will make a big impact to the patient. So measurement of AWC, or the abdominal circumference, is important. Fat thickness measurement using the normal digital caliper, which through my experience, it might be good, it might not be good, because this will also require you to be well versed with your method. You need to assign, basically you need to assign somebody who knows about what is this all about, how to use it, then only to apply or use that. Fat thickness is actually to check on the thickness of the fats underneath the skin. The best treatment, if you have the ability to use ultrasound, what they call machine, please do that. For me, I don't have that machine. I can only use a caliper, digital caliper, to measure fat thickness. Pictures, among the most important thing. As they say, pictures says 1,000 words. So I guess we need to take at least 5 photos. I did that. This is what I said just now, ultrasound, whether you have that facility or that capability to use ultrasound. Check on the thickness of the fats before the procedures. And GAIS, or the Global Aesthetic Improvement Scale. I have used this also to my patient. This is basically, this is from the perception of the doctor. So it's up to you. I use GAIS, but this is more on clinical trial, I guess. It is important to do this, but you can also measure the measurement of patient, patient satisfaction in your procedures. Yeah. As I said, this is important for effectiveness challenge. So believe me, especially non-invasive treatment, for those who are used to this, they will face the same thing. Patient will tend to challenge you again and again. Doc, they might say that I look the same. It doesn't give me any effect. The commonest question they will tell you basically, Doc, I spent 2,000 USD for this, but I don't see any improvement at all. So measurement pre-procedures is paramount, is important for everybody. This is one of my brochures. I was given by Jeisys to use their own form, but I guess I improvised. I put the thing that I think is important, such as the baseline measurement, the fluence, the total numbers of passes, the weight, the BMI, the height. Of course, it won't change, and the pin level. And also, I put down there is adverse reaction if there's any. Also, in pre-procedures, please, before we start, we need to determine the number of shots. For this matter, for lipo, number of shots relates to dollar and cent. The more you do, the more shots you do, the more patient have to pay. So make sure that you determine the perfect number of shots or area you want to do. Make sure that it is realistic, because if you were to tell the patient you need to do 1,000 shots of treatment of LIPOcel, I guess the patient, unless you find a multi-millionaire patient who doesn't care about that, then they don't mind. But I'm pretty sure some of them will just run away. But make sure that it's realistic, and at the same time you need to adjust. Those shots will work on that patient. That's why we are trying to tell you. I'd like to share with you. BMI shouldn't be more than 30. That means they are non-obese patient, and there's a localized fat. So you can determine probably 80 shots. It probably is enough. And stacking, whether you need to do 1 stacking or 2 stacking, numbers of passes, how many sessions you do. On the session part, this is where I told Jeisys when they come to when we discussed on before use LIPOcel machine in my clinic. I tell them that if you were to tell me that I have to do 3 or 4 times of treatment, I wouldn't want to do the procedure. I don't want to take up the challenge to do the clinical trial, because like all the treatment I have in my clinic, as for example RF, Zerona, you need to do several times to see good result. So I believe that I want something different. I want to my patient that if they were to pay me a certain amount, which is higher than the rest, and this is knowing that this is the latest technology, I want to share with one treatment will do the job. So this is actually, when I say that to Jeisys, I'm challenging myself. I'm challenging them to prove me that the outcome is good with 1 session. Yeah, and passes also. Actually, I told them that I want to make sure that going to show me that I can do it in 1 passes. So this is to save time. I want to share with my patient that probably I'm going to use 2 stacking or 3 stacking. The result is good. And of course, in the later slide, I will show how the thing works. But pain control energy level also should be determined before the procedures. Okay, now we go to the next step. Slide. The procedures. During the procedures, we need to do the marking and identify the area. This can only be understood if you were to see the whole procedure in personally. I think during demonstration, if you have the opportunity to meet up, I don't mind. I would love to share with you how we do this. Of course, the pressure should be the same throughout the the surface of our targeted area, same level, and pain tolerance is important. Okay, I would just want to show you pain tolerance is important. This is something that Jeisys didn't share with me when you use LIPOcel. I know it's there, but well, Leomi, I just want to share with you because, you know, in all the literature, there's a contradicting information about the effectiveness or the pain level or the pain or the energy need to be used to the patient. Some say that, you know, 160 joule is enough or 130 should work. Some will say that 100, more than 180 should work. And the literature, when they make the comparison, some say that it's irrelevant. The energy level they introduced is irrelevant. It's still going to leave a job. It will still damage the fat cell or the adipocyte and give a good result. So, but you know, when this LIPOcel come to me, they have different level. From I was given from 1 to 15. So which level should I use? This is where it puzzled me actually. If they say, if I were to go with the ideas that all level works with all the, we give the same result, why do I use level? Because patient basically doesn't have any pain, or we don't even need a cooling, a contact cooling, because you know, if we were to believe in that, or should I use a higher level to give a good result, to produce the most energy to that particular area? So well, and one thing for sure, that when we talk about this, in one literature, it clearly stated that they try to relate between the energy level and the result outcomes. What they say is that the higher you go, the more reduction there is. And what they said also, the higher the SE that you will introduce to the patient, the higher heat or temperature gonna be felt by the patient. So for this, I guess my strategy is to determine the
Hello, sorry to interrupt you. It seems like it's completely lost during his presentation, so I need to contact to Dr. Sherin for a moment now. So we will wait a little bit, just for a second, please. Dr. Unku, I'm waiting for you.
Are you okay? Can you hear me now? Can you hear me now?
Now you're back. Yes. So we were waiting. We were where
right.
we were.
Okay,
where I lost you. Yeah. About the pain
okay, all right then.
tolerance.
So yeah, that's right. This is where I said just a summary of this. So basically, my strategy when I was with my patient on the, what I did is just to make sure that as long as my patient can have the sensation between 4 to 6, which is moderate pain, then I will stick to that energy level. Let's say she is okay with level 12. So, and at level 12, she will say, Doc, I feel a bit uncomfortable, but it's still tolerable. So I will stick with that, and I will move on to the other area. I don't really change much on the energy level. I just need to get the the level, the pain tolerance is on the moderate side, between 4 to 6. If you were to come between 1 to 10, 10 being the highest, 1 being the lowest. Again, I think this is in practical session, you can understand more clearly what I meant by this. we're going to move on to the post procedures. Of course, after we do the procedures, these are the commonest thing. We need to understand what are the side effects and adverse. By knowing the physics behind LIPOcel, the what you call the biochemistry that happen, the mode of action of LIPOcel or HIFU energy, we can actually predict what might happen. First, you will see that there will be heat introduced in that particular area. So you might want to see if there's any burn mark, any blister coming up. And because of heat are introduced on the adipocyte layer, that probably contains blood vessels all over there. So we want to see if there's any hematoma, bruising, ecchymosis occurred during this procedures. My personal experience, the only adverse reaction that I see apart from the pain during the procedures is the ecchymosis that happened to the patient. I got 2 patients who has ecchymosis, but we solved within, well, 1 or 2 days. And then you need to do a follow-up to do the measurement between 4 and 12 weeks, and you need to advise your patient accordingly. This is also among the things that you need to understand what you know or what the patient to expect. And bottom line in this, I guess you need to tell the patient what are the things that they can expect. This is my case study basically. So this is when I do the reporting to the patient. I will tell them that, Madam or Sir, this is a male, 31 years old. I will tell them that total number of site is 30. We do 2 stacking because it's not too big. I only do on the abdominal part, frontal part of the abdomen. I only do 1 passes. I will the number of shots 2 is 60. I do 60 shots. I will take a follow. I will do a follow after 12 weeks, and the total fluence I use is 180 joule. And I will see. I will tell them, okay, the number of circumference, because this is based on the measurement, is -2, and the fat thickness is 2.5 centimeter. And then this is another example of my patient. I did on the female 58 years old. Normally, I will report to the patient that I will tell this lady, Madam, look, I did 4 shots or 40 sites, and using 2 stacking. That means double on the overlap on the same site 2 times. 1 time passes or 1 time pass with total shot of 80, and I will do follow up between 2 times, 1 in 4 weeks, another 1 in. I'm using a total fluence of 210. You can see that the abdominal waist circumference is -3.5 centimeter, and thickness reduction is -3.3 centimeter. And this is my case study. I'm not going to share too much now. Hopefully we can see and discuss this together during the next salsa session in Korea. But you can see that on 4 weeks and 3 weeks out of 10 patients, there's always a reduction, -3.5. After 4 weeks is -5 is the highest, and -3, and some of them didn't come back, so I can't get their measurement. You can see the energy level as compared to the other study that they are out there. Nothing go higher than 177. We can go at least 180, and the highest is 285. So without having any problem. Having any problem, this is where I think LIPOcel is well, better in the sense that they have a contact cooling, because of it gives the comfortable feeling to the patient, knowing that the heat doesn't really radiate to the upper part of our skin. And you can see that this is the fat thickness. I did mention this. I don't really like the using a digital caliper, because it depends on the operator who do the measurement. It can be a little bit haywire, a little bit confusing in terms of the outcomes or the result. And before I forget, if you want to do this measurement, the first few patients, I prefer to, myself, I will do it on my patient to make sure that the reliability, validity of the measurement is there. Okay, I guess that's all for my presentation. Now I think it's time for any questions. If any of the participants want to ask me, I will give this back to Yaomi. But before I end my session, just a brief one, a conclusion of what I just said. First, before you, hello? Before you embark in this, yeah, okay, Yomi.
Yes,
you can
I'm
actually
here.
you can
Always
continue.
here.
Yeah.
Okay.
Okay.
Okay. Thank you for your wonderful presentation. So, well, actually, quite many of doctors, we were waiting for your like a practical experience, because it's been since last month we've got quite many questions about all the like a comparison, how can you use this device, or etc., many of them. So actually I've got my questions here as well, but rather than that, actually Dr. Aditya Babaid, he asked us, what is the downtime of the treatment? So how do you think about his questions? Yes.
Thank you, Dr. Aditya. Yeah, thank you for the questions. The downtime, this is again, as I said, through my experience, out of all the patients that I've did for the past 1 year, there's no downtime actually. The only downtime, if there is any side effects or adverse reaction, which is ecchymosis, through my experience. Basically, when you do or you perform LIPOcel on your patient, a treatment on the patient can go back, no downtime, they can do their normal routine. That's it. I hope I can answer that
no doubt.
clearly.
Oh, yes. So, and also Dr. Sepsipika Jaiswal. I hope I read your name, Dr. Jaiswal.
Okay.
So, hi, which is better, cryolipolysis or HIFU for fat loss? So I think it's an extremely
Thank you very
common
much.
question they talk about. Yes.
Yeah, that's right. It's a very good question.
Right. Yes. Now
and I'm being neutral over here. Okay, I hope you guys can hear me. It's a common question, like you say, and I guess. Can they hear me now?
Yes, I can hear you.
Can you hear me?
Yes, I can hear you well now.
Okay, all right, great. Okay.
Yes.
Okay, so if you were to ask me which one is better, cryolipo or HIFU, I guess
yes.
Back to which one you prefer. Both of them, if you are talking about literature study, cryolipo being the earlier one in the market, they have more extensive study, and they do share with us that they do have a good result. Me personally, I will say that both of them have a good fat reduction effect, but LIPOcel, knowing the physics behind that it delivers heat energy, and to give a acute or a contraction effect to the patient, to the skin. The collagen denaturation is there. skin tightening effect is there. So for me, if I were to give to give a choice between that, cryolipo and HIFU, I guess I will HIFU, not because of the effectiveness, but because of two-in-one effect. I have a tightening effect to the skin that make the result better. Thank you.
Right. Thank you.
Okay,
So,
Yumi,
thank
back to
you.
you.
Yes, thank you. So since this actually this late January in Paris, and they're quite in all the lipolysis sessions, everyone just asked about which one is better, cryolipolysis or HIFU, for fat reduction, and actually there is quite many doctors who using cryolipolysis since like 5 years, and recently they have figured out some side effects occurred, and also as just Dr. Shahin mentioned now, so the HIFU heat, because the LIPOcel is a HIFU-heating system, so we all of us who using from LIPOcel, we are able to expect two effects, which is fat reduction and also plus skin tightening effect. So that's why I think that would be the good answer for Dr. Jaswal. Thank you, Dr. Unku. And during your answering, and there are one, two, three, 4, 5 questions more. So from Dr. Jules, Jose, Delio, Fernandez, Philo. Yes, it seems like he's from like Mexico or something like that. But the question is, what is the downtime? What is the downtime of the treatment? No, that's from the other one. What is the average duration in minutes to treat an abdomen? So what is the average duration? How long it will take to each treatment? How long was it?
Thank you. I think the doctor. Yeah, I understand. Thank you, Yomi.
Yes.
Okay, thank you, doctor. I think the doctor probably from Spain or from as you say, from Mexico. But anyway, hola. Basically, the time or the period duration for treatment depends on the shots. For LipoCell, per shots is equivalent to between 27 to 30 seconds. So if you were to do a simple calculation, if I were to do 100 shots on my patient, basically I need to do about 50 minutes. I require 50 time to do on one patient, one abdomen. If the patient is moderate size, probably I need to use 100 shots. If I were a smaller patient, probably require about 50 shots. So probably because one shot is 30 seconds just to count it. So you probably needs about 25 minutes to do that per patient.
No, 25 minutes per...
I said, yeah, because one shot is about equivalent to 27 seconds actually.
So one shot is approximately 26 to 27, less than 30 seconds, you mean? So approximately for each, how many shots? Excuse me, Dr. Shahrin, because during your speaking, your sound was a little bit losing, so...
about 100 shots.
About 100 shots?
About 100 shots. Yes.
Yes. And how long it will take?
So it's going to be about 50 minutes. 50 minutes for 100
50
shots.
minutes. 100 shots for 50 minutes, so 25, 50 shots for 25 minutes.
Yes, exactly. True.
Yes, yes. So, so I hope this one is good answer for you, Dr. Jose Delio. And his another question is, what is the expected percent of fat reduction per session? What is the expected percent? How many percent was decreased from single session?
Okay. In my experience, thank you, Yomi. For my experience, period, I only do one session. I don't really want to ask the patient to come back to me and redo the treatment. So my results are based on one session treatment using LIPOcel. I use that certain energy, and from my experience, I will share with everybody when I will present my clinical trial or clinical report. On average, is between, because I haven't put it in the SPSS system, but on average is about -2 to -5 centimeter of abdominal fat reduction. If you're talking about the size, if you're talking about fat thickness, it can.
Dr. Shaharin, when you're mentioning a really important one, and when I'm losing you. Yes, could you? Yeah. So, for the size reduction.
Why means that?
Yes, for the size reduction, how many percent we can expect? Again, please.
If the abdominal circumference, you're gonna see not in terms of percentage, but between -1 to -5 centimeter. -1 to -5 centimeter, one session.
Oui. So
no, -1 to and -5.
Yes.
Yeah.
So -1 to -5.
1 to -5.
5 centimeters for reduction of the girth. And how about?
There's one treatment.
Yes. So from the single session, one treatment. And how about the percentage of the fat?
Yes.
Body percent fat. Percent of body fat. Yes. How about?
Well, this is where.
I got what you described.
Okay, thank you.
You didn't put here. Yep.
Yeah. Okay. The percentage of fats is measured using. Normally, you can only measure using ultrasound. Then only you're gonna have a clearer picture of the actual percentage of fats. Unfortunately, for my study or in any clinic, normally we don't really check on the percentage. Even if you were to check on the literature available in any medical publication, they don't describe as the reduction in percentage, but rather the difference in the circumference size or the fat thickness. So in my experience, is between between centimeter to -5 centimeter of fat thickness. Of abdominal circumference reduction.
Oh, okay. Thank you very much. And there is another question from, yes, thank you. And we've got like 3 or 4 more questions here. So from, I know you, Miss Nguyen Yen, and she asked, can I treat 2 passes, taking time of 2, and thickness of that area, is it any risk? What do you think about it? Yes.
Okay, thank you. 2 passes or stacking is a parameter used to share or to tell us how many times you want to do or to deliver the energy. Basically, when we do 2 passes, we are what we try to achieve is to give more heat or more area to that particular area. When we talk about stacking, that means we are trying to give more heat to that particular area so that the heat can be absorbed by the surrounding tissues. So, in both cases, either you're going to increase stacking or you want to increase the number of passes, it does not have any adverse reaction or side effects to the. So it is safe for the fact that the energy delivered to that particular wouldn't cause any damage to the patient. Myself, my personal experience, I've even tried on my first patient using 3 passes on the same energy. They shouldn't have any side effects at all. Thank you.
Okay, thank you, thank you. And it's from Dr. Chang, Dr. Chang. And do you think the only indication region of LIPOcel is abdomen? What do you think?
Come again?
Oh,
What?
so yes, do you think the
Can
only
you say again?
Yeah. Can you hear me well? So do you think the only indication
Yes,
region of
I can.
LIPOcel? Yeah. Do you think the only indication region of LIPOcel is abdomen?
No. Thank you. This is something that I think is not only for abdomen, but even though LIPOcel only mentioned that the indication is only for the abdomen, I believe because with controlling the frequency, you can control the depth of penetration. I guess we can do on other parts of the body. Me personally, so I try to not to be adventurous. Maybe I try on patient thighs. When I see that the fat thickness is there, the same tip or same frequency, I can see that the outcomes is not too bad. I can see reduction on the patient.
Okay, thank you. And
for the time being, I think Jeisys come up with something, a specific tip for that specific area.
That's true. That's so true because
Thank you.
Thank you. So on March, and we have planned to launch because of many doctors are asking about is it only indication reason of LIPOcel for now? So actually, officially, yes, it is, but that's why we're planning launch the more, making it various depths for LIPOcel. So we'll see what happens on March. So, and let's move on. And actually, and also, thank you. And also from Dr. Chang mentioning about in his experience as well, the cryolipolysis was rather cryolipolysis, LIPOcel was showed better effective. Thank you, Dr. Chang. And there is another question from Dr. Fadate. And I think that will be our last answers, but because she asking you, please tell books that must read for cosmetic dermatology. What do you think, Dr. Unku, Dr. Sharon?
Okay.
Please
the first one. They'll answer the first one. It's about this doctor think that cryolipo is better than
No.
HIFU,
LIPOcel. No. Lipo is better than cryolysis. Was his comment? Was Dr. Zhang's comment? Actually, that the one he write down in English, in Korean. Yes.
I see. Okay. Yeah, I totally agree with that. I guess, to be honest with you, I don't have any cryolipo machine like Zeltic. You know, but however, I've seen how it is done. I went to my clinic and see how it is done. But myself, to put something cold and to have something that is, gonna have some blistering and bruising and paresthesia, you feel numb on the place, doesn't really mean that I don't see that it is enticing enough or interesting enough. Well, I totally guess so far I've been I do conventional lipo, I do non-conventional lipo, which is non-invasive lipo. So I guess the result is quite good actually. I don't have any complaint, and the fact that I have a tightening effect when I do use LIPOcel. Why not? I don't need to use extra treatment like radiofrequency to tighten up, because this is stated in one literature actually, saying that one of the recommendation when they use cryolipo, they are to use an RF treatment to give the tightening effect to the patient. So, well, if I were to use LIPOcel, I don't use both. I just need to use one machine. Well, that's what I guess my opinion. And second question asked about the good aesthetic dermatology. Okay, I will share. Wait, hold on. I could bring the books.
Okay.
Okay. Sorry. I thought I have the books with me. I always bring where I go. But it's about aesthetic surgery, aesthetic medicine book by Springer. But it seems to be a very good book actually. So, probably I can share. Yes.
Yes, that's what I want to ask.
Yes.
Yes.
Okay. So I guess I can share. It's about it's an aesthetic medicine book. I used to have. I don't know where I put it. I need to ask my staff. But that book is good to share with you what about aesthetic medicine. But asking me about certain technology, certain books doesn't even have any content like HIFU. They don't talk much about this, but I guess to know more, you need to read a lot of articles and this to really understand the new technology.
So about newly published article will helps for understanding the market and the situation itself. Is that what you mean? About techniques as well? Yeah.
Reading that's right. Techniques is, if through my experience, techniques differ from one person to another. It is more on like if you know the basic things. That's why in my earlier stage of my presentation, telling the doctors that understand the physics, understand the science behind that. Biochemistry or the medical science behind it. This is where we as doctors we learn it clearly. So now, how to use it when we are applying or using that in our practice in aesthetic medicine, and knowing the physics of aesthetic medicine, especially involve machines and instrument, is also important, even though it's a basic thing, because we can relate both things to predict what the outcome like. And when it comes to procedures, this is where it takes some time. You need to learn that from somewhere. That's the only way to go.
Okay.
That's it.
Thank you for your comment. Yes, so I think it's quite late for all of us today. And again, thank you for your wonderful presentation for today. And hopefully everyone enjoyed, I'm pretty sure everyone enjoyed all the lectures for today. And some of Dr. leave some comments and mentioning, and I will I'm making sure for now, and I will write you, each of you, for your questioning. So again, thank you, Dr. Sharon. Thank you for all the audience. Thank you very much. And we're looking forward to meeting you at March in South 2nd. It's on hold 14th and 15th. And the other questions I will follow up with you. So Thank you very much. Thank you for joining, everyone.
You're welcome. Thank you.
Thank you.
Okay, thank you everybody also for this.
Yes, thank you.
Okay, bye. See you.
Bye. See you.
Bye.
By the way, Dr. Sharing. Dr. Sharing.
Yes.
Before you're leaving, could you please leave your So could you please leave your answer for Dr. Fadade? Because she couldn't get the title of the book you're mentioning. Yes. So perhaps through yes, perhaps through chatting.
Wait, just give me 1 second. Can I just show it to you here? Wait.
Okay, I will wait. And everyone, you're free to go. Yes. And thank you for enjoying. Again, thank you for enjoying everything.
These are the books that I believe that all doctors. This one, they can snapshot this, I hope. Wait, okay, here.
Move closer, please. Aesthetic medicine.
Can you?
Yes.
Okay.
Closer, please. Closer.
Yes.
Yes. It's aesthetic medicine. Yes. I think that's Dr. Sharing.
By Springer.
Yeah, it's by Springer. I think that was his last comment from Dr.
And then
Sharing.
another one is this.
Another one, laser and IPL technology.
This one is second book.
Okay. I can't see it well.
This is also very good
Laser and IPL technology in dermatology and aesthetic medicine. Laser and IPL. Yes. Laser and IPL technology for dermatologists and aesthetic medicine. I hope this will be really good recommendation from Dr. Sharing. Thank you.
Yeah, you're welcome.
Thank you for everything.
Okay, guys.
Yes. Thank you. Bye. Yes. Bye. Good night.
Bye.
Bye.
Bye. Bye.